Welcome to ASWB MSW exam practice test. Our topic today is practice test. Use the link in the description to download the app on the App Store for free practice tests. Number 1. When evaluating a 16-year-old girl's depression, you discover that she's distressed, in part, because she has never learned to drive. Consequently, she's passed up occasional babysitting jobs, social events, and other activities. She feels inferior to others. Pointing this out to the parents, her father states, "She just can't learn. I've taken her driving and shown her what to do many times, but she isn't able to cut it." You recommend enrollment in a professional driving class, but the father resists, saying, "There's nothing some driving instructor knows that I can't teach her." To overcome his resistance, you note the unique driving tools available to an instructor and explain the concept of A. Behavior modification, B. Interactive scaffolding, C. Defense mechanisms, D. Analytic depression. The answer is B. Interactive scaffolding. Explanation. The human development theorist Lev Vygotsky focused his research primarily on child development and introduced a concept later known as scaffolding. His original concept, called the Zone of Proximal Development (ZPD), explains how a child functions at a lower limit if all help is withheld and moves to a higher level with skilled assistance. Scaffolding is an extension of ZPD. It refers to a teaching pattern where an adult provides more intensive assistance to a child at the outset of learning a difficult task and then tapers back as greater skill is acquired. A professional driving instructor uses a teaching vehicle with 2 steering wheels and 2 brake pedals, which allows for a measured transition between teaching and allowing the new driver to gradually assume full control. Scaffolding is not possible in a vehicle lacking these tools. Behavior modification may be helpful in extinguishing a persistent bad driving habit, but not in optimizing initial training. Defense mechanisms may explain the daughter's inability to learn from dad, but not the path to learning. Analytic depression is a concept from attachment theory with no bearing on this situation. Number 2. Which of the following concepts from social psychologist Kurt Lewin would be most helpful in understanding the powerful role of peer pressure? A. The behavioral equation, B. Force field analysis, C. Sensitivity training, D. Leadership climates. The answer is A. The behavioral equation. Explanation. A German and American social psychologist, Lewin produced a heuristic formula by which to explain social behavior. B equals F of P and E, where B is behavior, P is person, and E is environment, illustrating how behavior is a function, F, of a person and his environment. Prior to this, efforts to explain individual behavior were largely limited to exploration of a person's past. Thus, the influence of peer pressure is best explained by exploration of a person's traits, past, immediate goals, and the social environment in which a behavior occurs. Force field analysis, which identifies both helping and blocking forces as related to a goal, is too limited a perspective for the concept of peer pressure. Lewin's concept of sensitivity training may help moderate peer pressure, but it fails to explain it. Finally, Lewin's work on leadership climates, authoritarian, democratic, and laissez-faire, also has only limited bearing when attempting to explain peer pressure and group dynamics. Number 3. As a hospital social worker, you are assigned to work with families in an intensive care unit. A husband was recently told that his wife is terminally ill. In speaking with him, you attempt to discuss his feelings about the impending loss of his wife and how he and his family are coping. However, you find the conversation persistently returning to recent medical tests, current physical indicators, and potential changes in her medications. This is an example of the following defense mechanism. A. Projection, B. Compensation, C. Intellectualization, D. Rationalization. The answer is C. Intellectualization. Explanation. Specifically, intellectualization occurs when an individual attempts to use logic and reasoning to avoid facing difficult feelings. As with many other defense mechanisms, this coping effort is not necessarily problematic, as it may offer the spouse place of refuge until he is psychologically ready to encounter the devastating feelings that it is covering. Thus, this need should be recognized and accommodated, unless it becomes unduly protracted and are exclusive of gradual exploration of the underlying emotional concerns. Projection addresses the denial of one's own negative characteristics while attributing them to someone else. For example, I'm not a racist. You should see what my mom says about foreigners. Compensation refers to success seeking in one life area to substitute for barriers in another that cannot or have not been overcome. Rationalization involves hiding one's actual motivations under an appeal to more socially acceptable reasoning and logic, such as saying, I can't make the trip because the kids are sick, instead of admitting you don't enjoy the people or activity. Number 4. A 32-year-old single woman comes to see you about depression. You notice that she wears an excessive amount of makeup, dresses in teen-style attire, wears her hair in a faddish fashion, and uses a mixture of old and new-era teen terms and language. As you talk, she narrates activities dominated by associations at teen and young adult clubs and haunts, and describes attempted relationships with individuals much younger than herself. When you ask about peer relationships, she indicates that she avoids those her age, as she does not want to become old before her time, and sees herself as much more youthful than others her age. The defense mechanism she employs is best described as A. Avoidance. B. Fixation. C. Devaluation. D. Affiliation. The answer is B. Fixation. Explanation. The defense mechanism known as fixation refers to arrested personality development at a stage short of normative maturation. This client clearly identifies with individuals and activities that fall short of her age and maturity level. While enjoying youthful associations is not in itself problematic, seeking to live in those associations to the exclusion of normal relationships and activities is problematic. Identifying, addressing, and overcoming the reasons behind this will likely be a major therapeutic endeavor. Avoidance is characterized by a refusal to become involved with objects, situations, and/or activities that are related to underlying impulses to avoid potential punishment, such as staying away from casinos to cope with a predilection for gambling, instead of discovering and overcoming the underlying reasons for the compulsion. Devaluation involves the attribution of negative qualities to oneself or others to cope with stress or internal emotional conflicts, such as coping with being fired from a job by speaking negatively of the job and work colleagues. Affiliation involves seeking emotional support and advice from others instead of going it alone, yet without trying to make others responsible to step in and fix the problem. Number 5. You are counseling a man at a walk-in community clinic. He had moved in with his girlfriend but was recently evicted from her home. His way to work was by riding with her, and he now is unsure how to keep his job given the loss of transportation. This has left him with no stable living situation and in danger of unemployment. He has no family or close friends in the area. Emotionally, however, he is preoccupied with the loss of his relationship and the security and affection he found through it, which is all he wants to talk about. According to the theorist Abraham Maslow, the best response to this situation is to A. Go where the client wants to be and work on his feelings about the relationship loss. B. Refuse to talk about relationship issues until immediate needs regarding housing, transportation, and employment are met. C. Permit some discussion on feelings of loss, but keep the focus on his immediate housing, transportation, and employment needs. D. Explain to him that his needs are beyond what you have to offer and refer him to a shelter program. The answer is C. Permit some discussion on feelings of loss, but keep the focus on his immediate housing, transportation, and employment needs. Explanation. Abraham Maslow's needs hierarchy posits that more essential and basic physiological needs must be met before higher-order needs. Thus, needs regarding food, clothing, and shelter are more important than needs for safety, security, protection, predictability, and structure, belonging, friendships, affection, intimacy, esteem, recognition, respect, and appreciation, and self-actualization, meeting one's full potential. Thus, while it is important to acknowledge and make some room for the client's feelings of grief and loss, it is crucial that more basic survival needs be met first. Just going where the client wants to be is clinically irresponsible. Rejecting all talk about relationships and loss would be alienating, and referring him away would be abandoning him without the support that is available through the agency. Number 6. A 38-year-old man is being seen in an STI, sexually transmitted infections, clinic for treatment of chlamydia. You have been called to discuss his sexual history with a focus on safe sex practices, particularly while being treated. You learn that he has a history of short-term sexual relationships with women, with many involving one-night encounters. He also admits to occasionally paying for sexual favors. According to the ego psychology theorist Erik Erikson, this client is struggling with master of the following stage of personality development. A. Stage 1. Trust versus mistrust. B. Stage 5. Identity versus role diffusion. C. Stage 6. Intimacy versus isolation. D. Stage 8. Integrity versus despair. The answer is C. Stage 6. Intimacy versus isolation. Explanation. This stage is typically mastered during young adulthood, ages from 19 to 30. Indicators of successful resolution include establishing a committed, intimate, non-exploitative sexual relationship with meaningful tolerance for the burdens and risks that accompany the relationship. The client has not been able to establish a reciprocal, loving, intimate relationship with another individual. The sexual relationships that he has produced are transient, non-committal, and often exploitive. Failure to negotiate this stage results in increasing isolation and narcissism. Stage 1, trust versus mistrust, is not correct as the issue of failures in trust has not been identified. Stage 5, identity versus role diffusion, is not correct as the client does not present with issues related to roles and self-identity. Stage 8, integrity versus despair, is not correct as this is an end-of-life construct dealing with self-assessment in retrospect, and the client is not at this point in life. Number 7. A 28-year-old woman comes to see you with complaints about rejection by her new boyfriend. They've been dating for about 6 weeks, and she notes that he's just no longer being as attentive as he was. She wants to know what to do to win him back. Upon further inquiry, you learn that she's experienced this in all her prior dating relationships. You further learn that she calls, texts, drops by, and otherwise attempts to stay in contact throughout every day. She voices great fear that he will soon leave her like the others. As she talks, you note high lability in her emotions, ranging from fear and anxiety to intense anger. She also uses frequent criticism of herself, suggesting she is not worth having a relationship with, etc. You quickly recognize symptoms of likely borderline personality disorder. In considering a treatment approach, you draw upon Margaret Mahler's work, which posits that this disorder likely occurs from problematic experiences during A. Normal autism phase. B. Symbiosis phase. C. Differentiation or hatching phase. D. Rapprochement phase. The answer is D. Rapprochement phase. Explanation. Rapprochement is one of 4 substages in stage 3 of Mahler's child development model. During this substage, an infant, 15 to 24 months of age, begins to strive for autonomy. Success requires maternal support as the infant ventures away from immediate contact and frequently returns for encouragement and assurances of security. Where these are not forthcoming, an infant can develop anxiety and fears of abandonment. This can evolve into a dysfunctional mood predisposition that, Mahler felt, could later produce borderline and/or narcissistic personality traits or the full disorder. Answer. Normal autism phase is not correct, as it refers to a natural obliviousness to the external world common from birth to 1 month. Answer. Symbiosis phase refers to high levels of attachment between mother and infant from 1 to 4 months of age, with deprivation or disruption, potentially resulting in later symbiotic psychosis and disconnection from reality. Answer. Differentiation or hatching phase refers to an infant's realization of being separate from its mother. As an awakening, rather than a process, it does not produce psychological failure. Number 8. A normally well-behaved 15-year-old girl is being seen for her recent onset of conflict and behavior problems. The parents are overwhelmed and in need of direction. They have used a variety of behavioral modification techniques, such as lectures, restrictions, grounding, loss of privileges, without success. The behavior has become so problematic that it has impeded the father's normal overseas travel for work. With further inquiry, you learn that the father's employment has taken him away for extensive periods in the child's life, but that she now has his nearly undivided attention. Drawing upon the operant conditioning work of B.F. Skinner, you identify the problem as one of A. Positive reinforcement. B. Negative reinforcement. C. Punishment. D. Extinction. The answer is A. Positive reinforcement. Explanation. The teenager's acting out led to a variety of responses and punishments. However, it is revealed that the teenager's underlying goal is time and attention from her father. As negative attention is better than no attention at all, that is positive reinforcement, the teenager continued to act out to receive and extend attention from her father. Answer: negative reinforcement is incorrect, as it refers to the repetition of a desired behavior to avoid negative stimuli, consequences. The parents were supplying negative stimuli, stern lectures, to produce and strengthen positive, cooperative behaviors. Answer: punishment was also being used to weaken the teen's use of negative behaviors. Answer: extinction refers to the weakening of a conditioned response in one of two ways. 1. In classical, Pavlovian conditioning, it involves interrupting the pairing of a conditioned stimulus and an unconditioned stimulus. 2. In operant conditioning, it occurs when a trained behavior ceases to be reinforced, or when the reinforcement is no longer considered rewarding. Ignoring bad behavior is one operant conditioning way of bringing it to extinction. Number 9. The difference between Ivan Pavlov's conditioning and B.F. Skinner's operant conditioning is: A. Pavlovian conditioning deals with the modification of voluntary behavior via consequences, while Skinner's operant conditioning produces behavior under new antecedent conditions. B. Skinner's operant conditioning deals with the modification of voluntary behavior via consequences, while Pavlovian conditioning produces behavior under new antecedent conditions. C. Pavlovian conditioning deals exclusively with involuntary bodily functions, while Skinner's operant conditioning deals solely with voluntary behaviors. D. Skinner's operant conditioning deals exclusively with involuntary bodily functions, while Pavlovian conditioning deals solely with voluntary behaviors. The answer is B. Skinner's operant conditioning deals with the modification of voluntary behavior via consequences, while Pavlovian conditioning produces behavior under new antecedent conditions. Explanation. Ivan Pavlov's classical, or respondent, conditioning utilized the identification of an unconditioned, natural stimulus that evokes an unconditioned response, that is, food-inducing salivation. A conditioned stimulus is created when an unconditioned stimulus is repeatedly paired with a stimulus to be conditioned, such as ringing a bell with the presentation of food, which evokes the unconditioned response, salivation, which is gradually transitioned into a conditioned response, salivation at the sound of the bell. Skinner identified an antecedent, stimulus, that could be used to produce a response, behavior, that could be controlled or modified by means of a consequence, positive or negative. Positive and negative reinforcement strengthen targeted behaviors, while punishment and extinction weaken targeted behaviors. Number 10. A couple is receiving counseling to overcome identified obstacles and increase marital satisfaction. In the course of several visits, you become aware that the husband often speaks of his duty to his family and his obligation to do right by them. Using Lawrence Kohlberg's multi-stage model of moral development, you identify the husband's level to be: A. Level 1. Stage 2. B. Level 2. Stage 4. C. Level 3. Stage 5. D. Level 3. Stage 6. The answer is B. Level 2. Stage 4. Explanation. This stage embodies a law and order perspective, focused on adherence to concrete perceptions of correct behavior and duty. Clearly, the husband is intent on ensuring he does not fail in his role as husband and father. To increase marital satisfaction, however, the husband needs to progress beyond levels 1 and 2 and past level 3. Stage 5, societal expectations and agreements, into stage 6, which is conscience and ethics driven according to principles of goodness and morality. Answer: level 1. Stage 2 is incorrect, as level 1, pre-conventional morality, is focused first on a punishment avoidance orientation, stage 1, and next on a reciprocity instrumental orientation, stage 2. You scratch my back and I'll scratch yours. The husband is beyond these stages. He is also beyond level 2, conventional morality, which deals with approval seeking, stage 3. Being good for praise. Answer: level 3. Stage 5 is incorrect, as it refers to behavior that has been carefully examined via a social contract perspective. Finally, answer level 3. Stage 6, ethics and morality driven is the desired goal which has yet to be pursued. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.